Hi, my name is Melissa Olson. I first just want to start out saying thank you for taking the time out of your busy day to watch my video. I decided to make a video just to try to give some more insight into why I've created this fundraiser and exactly what's going on in my life. It'd be about 2 years ago, coming up in the spring, that I've been struggling with severe persistent allergic asthma. Started out, I got really sick, coughing, and couldn't breathe. Felt like I had an elephant sitting on my chest. Went into the urgent care, and they told me it was bronchitis. Gave me some antibiotics. Sent me home. The next day, it was even worse. Was struggling to breathe, just talking with people. Went back to urgent care and was immediately sent to the emergency room, which ended up being one of the first of multiple week-long hospital stays. The first time I was there for about a week. They started me on massive doses of steroids, inhalers, nebulizers. Once they felt they got me stable enough, sent me home. That was only the beginning of my journey. I've had multiple hospital stays since. Each time, asthma is so severe that I'm usually in the critical care unit for about a week. The prednisone that they put me on causes my heart rate to jump up really high, along with the inhalers that I take. I have a rescue inhaler and EpiPens that I carry with me at all times. And I have to take daily inhalers, and it's taken inhaler after inhaler and inhaler to find one that somewhat works to help manage this. Allergy medication, allergy testing. When they did the allergy testing, I came back allergic to everything under the sun, trees, grass, weeds, pets, all those types of things. And speaking of tree, the tree behind me is fake this year. I don't have a real tree because of my allergies. And so it was, all this testing and hospitalizations is, being in a critical care unit for a week. It's a couple $1,000s a day. And even though I have health insurance, there's still a large portion of that I'm financially responsible for. Eventually, I had met a doctor named Dr. Krishna, who's a leader in pulmonary medicine, and he is doing a new procedure called bronchial thermoplasty that they finally decided to do on me because I was such a severe case and it couldn't be managed with just inhalers and prednisone. So it's a series of 3 procedures that you have. They go into different lobes of your lungs each time, and they go in with a catheter and use thermal energy to debulk the smooth muscles in your lungs so that your bronchi can't swell up as much. This does not cure the asthma. It just makes and hopes that the asthma attacks will be less severe and more manageable with prednisone and inhalers. So I had that procedure done last October. It had to be approved. It's so expensive. It's $30,000 a procedure, and there's 3 of them. It had to be approved by insurance before they would do the procedure, and after they did the procedure, insurance came back and said they didn't want to pay for it. So we fought them on that. So far they've agreed to pay 2 of the 3 procedures, and we're still fighting them on the 3rd one. And in the meantime, one of the procedures, I developed a blood clot in my lung that resulted in a week in the hospital. Another time I developed an infection in my lungs, which resulted in throwing out my back and breaking a few ribs because the coughing was so severe and there wasn't any medication that they could give me to make it stop. I'd have every couple of hours the breathing therapist would come around and give me breathing treatments through nebulizer. Each time I was sent home with a nebulizer, nebulizing treatments to do at home, and as you can guess, missed a lot of work. The last time I was in the hospital was in January. I had developed pneumonia due to a cold that I caught that turned into pneumonia in the critical care unit again. I was, always a nurse's favorites because I was the youngest person there. Everybody else is in their 70s and 80s, and always try to keep a smile on my face and stay positive. At that point, the doctors decided to put me on medical leave from work, and that was really hard. I'm always work full time, and I'm proud of myself for being able to support myself, and it was really depressing to find myself in a situation where I couldn't do that anymore, and financially stressful because bills constantly come in the mail, the portions that the insurance aren't going to cover that I'm financially responsible for. I was finally able to return to work in June, but since then the asthma has persisted, even despite using inhalers and allergy medications. I usually get sick about once a month with severe asthma that results in me being home anywhere from 2 days to a week, and until they can get it back under control. I used to have to take the highest dose of prednisone. I was on that for like a year, which has caused many other side effects. I developed steroid-induced Addison's disease, which took a while. The doctors now think that I'm developing rheumatoid arthritis from the effects of the long-term steroid use. Not to mention weight gain. I gained about 45 pounds. You get the moon face. Some people are familiar with that. Basically, it's a day-to-day struggle, and I think a lot of people think of asthma, they think is, just coughing and you use your inhaler and you're okay. And, before this happened to me, I thought that's exactly what asthma was. And I now know it's a serious thing. It's not, something they can intubate you for or force oxygen. Once your bronchi swell too much, there's no getting oxygen in, and it's death. And so I live with that looming over me, and I try not to dwell on it and stay positive, but it's scary when, right now it's wintertime, the colds are going around, and every time I get a cold it turns into severe asthma situation. They start me on antibiotics right away because it usually I develop a lung infection, and all these things are expensive, the medications, the hospital visits, just on and on I could go. The hospital stays I've had, future hospital stays that I could potentially have in the future. And the unfortunate thing is the bronchial thermoplasty that I had, it has helped decrease the frequency of the asthma attacks and allowed me to return back to work and lessen the severity some. This procedure only lasts for 3 years, and then I would have to repeat it. And at this point, with the way the insurance companies are, I don't know that I will be able to have this procedure again in the future. This past month, I've started allergy injections in hopes of reducing my allergic reactions, and but that can take up to 6 months to start to see results, all the way to 5 years. And I have to go weekly for those. Each time that's a copay. So it just adds up so fast between the medications and the copays and hospital visits. And currently right now I'm at $10,000 in debt, in medical debt. And even though I work full time, I live in Sunnyvale, California, and it's an expensive place to live. So I don't have options of moving. I would like to move to see if that would improve my asthma. Doctors have told me that it's unlikely that it will, because with allergic asthma you can develop allergies to anything that's similar. So basically my allergy profile would just change and the asthma would persist. But it's something that I would at least like to try, but I can't even consider moving until I can pay some of these medical bills and start being healthier and maintain a normal work schedule. And I used to be very athletic. I was an avid runner. I can't do any of that anymore. I loved camping and hiking. I can't camp because I can't have campfires around. Just simple things people don't think about. Someone's perfume can set off my asthma attack. A candle you have lit, the scent can set off the asthma attack. I currently run air purifiers in my house right now to try to keep the allergy profile down in my home. Those are expensive, so it's been a long journey. I live with the fear constantly of what tomorrow will bring, but I try to be positive and just keep a good attitude and think the best. So anyway, I don't want to take too much of your time. I'm open to any questions. I'm an open book. You can message me through my page or email me at mro107@hotmail.com. If you have any questions, I'm happy to answer. And don't feel pressure to give a big donation, $5, $10, anything at this point helps so that I can pay these medical bills. And anyway, thank you for your time, and I hope you'll have a wonderful holiday.